Hi, you guys. Welcome back for your daily practice questions. As always, I like to start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder that y'all know I always like to go over is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos that you may see, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing change resolution. They are discussing the process of including a third person to aid in the conflict resolution. What is this called? Is it A, negotiation, B, collaboration, C, mediation, or D, consultation? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is truly being asked. The stem of the question here states, what is this called? So we need to look back and get some more details as to what they're talking about, right? So, I've been going over non-clinical content with you, just trying to show you different things and tools and terms and looking at it so you can apply the definitions and terms that you have been studying appropriately. So the NP and the NP student are discussing change resolution. Now, the change resolution that they're discussing is a process of including a third person to aid in the conflict resolution, right? So when you do this, that is C, mediation. Mediation is when there can be two parties or two people, and you add in a third person or party to help aid in the process of resolving that conflict. Okay. So mediation. Question number two, the nurse practitioner and NP student are discussing the ethical term defined as truth. What is the appropriate ethical term? Is it A, dignity, B, veracity, C, justice, or D, beneficence? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, what is the appropriate ethical term? What is the appropriate ethical term? So the NP student and nurse practitioner are discussing the ethical term defined as truth. So the answer here is B, veracity. Veracity means truth. And then lastly, question number three for today. A patient is inquiring about coverage for labs with Medicare. Which Medicare plan covers labs? Is it A, Part A, B, Part B, C, Part C, or D, Part D? Take a moment and tell me what you got in the comments, you guys. So stem of the question here states, which Medicare plan covers labs? So Medicare Part B, remember that basic Medicare plan handles your outpatient needs like your labs, your surgery, your DME, things like wheelchairs, walkers, things of that nature, okay? So Medicare Part B. All right, you guys, another short and sweet non-clinical question video. But as always, I hope you found this helpful. But be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure to meet me back here. If you need any other resources that I offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number one at gmail.com. A few things that I offer. It's my review book. You can get it either in an ebook or the paperback option. Both are linked in the bio of this channel. This is a quick resource and tool that you can utilize on the go, broken down in the fashion of how I teach assessment, diagnosis, evaluation, and treatment, right? And then with each system, you have an interactive section to assess your knowledge, to fill in the blank based off of what we have reviewed on the system. There are many medication sections associated with each system. And then there's questions at the end with rationales. And if you're looking for something just to review independently, watching videos, to study on the go, my online self self-paced, independent on-demand review course. It's also linked in the bio of this channel. It's designed for family and adult Gero reviewers preparing for both exams. It does include a non-clinical section in that review also. And, of the 5-week group review, that is one of our group review plans that's broken down over 5 weeks to structure your studies on a system by system basis. And our next one is up and coming for September. So be on the lookout to enroll for that. And then if you would like to enroll in any of the one-on-one sessions, feel free to reach out. I always say, give us a call or shoot us an email, because these are so customized that we need to discuss what your needs are to gauge what is truly appropriate for your studying. So you can either get a one-on-one session to cover 1 to 2 areas of weakness. You can book an exam readiness assessment, or you can book the custom package plan where you have an initial pretest to gauge where you are. Then, based off of the time that you are looking to review, I design a structured study plan for you and work alongside with you during that time frame to get you to a successful exam day. All right. So if you're needing any of those resources, feel free to reach out to the Nursing Studio. But as always, make sure to meet me back here. Happy studying. Bye, y'all.